Hi Nick, I'm Zach and I'm going to be your student physical therapist today. The first thing that I'm going to do with you is take a look at lumbar flexion in active range of motion. So before we take the measurement, what I'm going to have you do is I'm going to have you face this way. And just to see if you can do that range of motion, keeping your knees straight, I want you to go ahead and touch your toes and bend forward as much as you can and come back up. So everything looks good. So what I'm going to be using today are inclinometers, and for this, we want to make sure that they're zeroed out based on each individual patient. We're going to be go ahead and finding the T12 by finding rib 12 and then following our way to that spinous process. And that's where the top one is going to go. And once that's here and zeroed, we're going to place the second one in line with S2, which is also in line with the PSIS. So from here, what I'm going to have you do is to go ahead and go into that same lumbar flexion. Okay, good. And then what we're looking for is 90 degrees and 60 degrees. So he has about 30 degrees of lumbar active range of motion flexion. So some of the things that we can see with active range of motion limitation is bending of the knees to try and get into that deeper flexion so that way we can get rid of the hamstrings. Also, some things that we can see is tightness of the erector spinae muscles that will kind of stop him from going deeper into that flexion motion. Okay, and so the second thing that we're going to test is thoracolumbar extension manual muscle testing. So for this position, Nick is going to be in a prone position, and we're going to be testing muscles of the erector spinae and the multifidus, which is innervated by the dorsal spinal nerves or the dorsal rami spinal nerves. So for this, we're going to test a grade 5 out of 5, and for that to happen, we're going to have Nick place his hands behind his head. So go ahead and do that, Nick. And from here, he wants to get his back toward the ceiling and the xiphoid process of his chest off of the table. What I'm going to do is I'm going to be stabilizing his thighs. So from here, Nick, go ahead and bring your back toward the ceiling and come back down. So his xiphoid process did clear the table, so that would be considered a 5 out of 5. If he was not able to do that, he would put his hands behind his back instead for a grade 4, and then hands to the side if it was a grade 3. And what I'll be doing is, if he can't even do that, I'm going to put my hand on top of his back, and if he can lift up his head a little bit, that'd be considered a grade 2. And if he can't do that, then I'd be looking for any muscle tone as he attempts to lift up his back for a grade 1.